let me introduce myself. My name is Maria Peinado. I'm a Public Health Information Officer with the Imperial County Public Health Department. Muy buenos días a todos. Mi nombre es María Peinado. Soy la oficial de comunicación pública del Departamento de Salud Pública del Condado Imperial. So just to let you know what we're doing this morning, we're going to start off with our panel of speakers. We have Supervisor Mike Kelly, Chairman of the Imperial County Board of Supervisors, Ms. Jeanette Angulo, Director for the Imperial County Public Health Department, Dr. Christina Tafoya, Vice President of Academic Services for Imperial Valley College, and Dr. Dave Duncan, Director for the California Emergency Medical Services Authority. So what we're going to do today is we're going to have our panelists share information with everyone and an update about what's happening today. And from there, we're going to open it up to questions from our media representatives. At that point, we're going to allow you to take some pictures of the clinic behind us. However, for safety reasons, we will not be permitting anyone to enter the parking lot during that time. Because we have a lot of moving vehicles, we want to make sure that everyone is safe while they're participating in today's event. We will allow for interested media an opportunity to speak with participants in this clinic following the news conference, and we'll share instructions on how to do that afterwards. So please be patient. We know that that's something you are probably interested in doing, so we are accommodating you as much as we can with that opportunity. So thank you very much. With that, we'll get started with our first speaker, Supervisor Mike Kelly, Chairman of the Imperial County Board of Supervisors.
Well, good morning, everyone. What a beautiful day we have here today. So before I get started, let me take this opportunity to express my sincerest condolences to the families, friends, and the community that has been greatly impacted by COVID-19. And for those of you who have lost loved ones over the past year or battling or recovering from the virus, you are all in my prayers. There's not one person in this nation that hasn't been touched or affected by COVID-19. We've been on the front lines battling this heavily armed enemy for almost a year. And on the front lines, we've had, it seems like BB guns and hand pistols to deal with this deadly enemy on the front lines. But now, finally, we have some artillery to assist us in defeating this horrible and terrible enemy called COVID-19. I'm glad you're all here today to see the first time that we have put on a mass clinic to inoculate citizens against COVID-19. I say the first one. This will not be the last one. As we receive more vaccines, we will put together and organize more mass vaccines for the community. I want you to rest assured that the County Board of Supervisors, the Health Department, the municipalities, and all agencies in Imperial County will be working with the state and federal government to ensure that we get our ample supply of vaccine to work with all of our community. You know, something like this just cannot happen. It takes the collaboration and cooperation of all agencies to make this successful. We have the County Health Department, the Board of Supervisors, the local hospitals, all the providers that have to come together and work very hard to ensure that we maintain the health, safety, and welfare of every citizen of Imperial County. At this time, I'd like to highlight some people that have worked very hard to make this happen today, and that's the departments and the staffs with the County of Imperial. They include the Public Health Department, Public Works, the Sheriff's Office, the Fire Department, Social Services, Area Agency on Aging, and the County Executive Office, and others, and all the volunteers that are here to assist today. I'd also like to thank the Red Cross for assisting our staff and our volunteers as they work extremely hard today. And last but not least, I would like to thank the Imperial Valley College for allowing us to use this venue. It is centrally located, it is very well organized, and unfortunately, it's a beautiful, beautiful place. So I would like to thank Imperial Valley College for allowing us to do this on this site. The next speaker today will be Dr. Christina Tafoya. She is the Vice President of Academic Services for Imperial Valley College. So I will be turning the microphone over to her. Thank you very much. God bless you. And people say have a wonderful day. I say have a wonderful life. Thank you very much.
Good morning. Imperial Valley College is an institution of this community, and we cannot express how grateful and proud we are to be able to work in partnership to offer this much-needed clinic to our community today. We are also so very proud and thankful for the many faculty, students, and other employees who have set this up and who are volunteering their time to work today, because we know how important this is to Imperial County. Thank you.
Good morning, everyone. Jeanette Angulo, Imperial County Public Health Director. We would like to share with our community that our thoughts are with all the families that have been affected by COVID-19 in our community and have family members or friends that are infected with COVID or have lost a loved one. These losses will be with us for years to come, and it makes us as public health officials even more dedicated and determined to get vaccine out to our community members as quickly and efficiently as possible. Today, we are here to kick off our mass vaccination drive-through efforts for Imperial County. We know that our community is interested in receiving their vaccine in a variety of settings, including at drive-through clinics, and fortunately, we received enough vaccine this week to make this happen. We have approximately 1,300 doses of vaccine available to offer to individuals 65 years of age and older today. Even though 1,300 sounds like plenty, we know that there are many individuals that were unable to schedule an appointment for today's event, and we want you to know that there will be other mass vaccination events that will be held in other parts of the county. This is the first, however, it will not be the last. As more vaccine is received in our community, additional mass vaccination events will be scheduled. We ask for your patience as we roll out our mass vaccination efforts. Our staff is protecting our vaccine to assure that every single dose is used responsibly. We know that this is a valuable and much needed resource for our community. Please know that none of the doses will go to waste. Today's clinic is truly a team effort and would not be possible without the partnerships we have with our agencies like Imperial Valley College, the Imperial County Office of Emergency Services, various County of Imperial departments, AMR, Area Agency on Aging, CalMat, and many others. We thank all the volunteers who are offering their time today to provide vaccine to our community. Deseamos compartir con nuestra comunidad que estamos con todas las familias que han sido afectadas por COVID-19 en nuestra comunidad y que tienen a familiares o amistades que han sido afectadas por el COVID-19 o han perdido a un ser querido. Estas pérdidas nos afectarán por muchos años y el personal de salud pública está comprometido a hacer todo lo posible para ofrecer la vacuna de manera eficaz y rápida. El día de hoy estamos iniciando con nuestros esfuerzos de vacunación masiva en el Condado de Imperial con este evento de vacunación por servicio vehicular. Sabemos que a nuestra comunidad le interesa recibir su vacuna en una variedad de formas, incluyendo en eventos de vacunación por servicio vehicular, y afortunadamente hemos recibido suficiente vacuna esta semana para hacer esto posible. Contamos con aproximadamente 1,300 dosis de vacuna para ofrecer a personas de 65 años de edad y mayores el día de hoy. A pesar de tener solo 1,300 dosis disponibles, sabemos que muchas personas no alcanzaron a hacer una cita para el día de hoy y queremos decirles que habrá más eventos de vacunación que se ofrecerán en otras partes del condado en un futuro. Este es el primero, mas sin embargo no será el último evento. Conforme vayamos recibiendo más vacuna en nuestra comunidad, se programarán más eventos de vacunación. Les pedimos que por favor tengan paciencia. Nuestro personal está cuidando la vacuna para asegurar de que cada dosis se utilice de manera responsable. Sabemos el valor de este recurso para nuestra comunidad. El evento de hoy es realmente un esfuerzo en equipo y no podría ser posible sin la coordinación de nuestras agencias como el Colegio del Valle Imperial, la Oficina de Servicios de Emergencia del Condado de Imperial y otros departamentos, los servicios de ambulancia AMR y la Agencia del Área para Personas de la Tercera Edad, CALMA y muchas otras agencias. I will now pass it over to Dr. David Duncan, Director of the California EMS Authority. Ahora escucharemos unas palabras del Dr. David Duncan, director de la Autoridad de Servicios Médicos de Emergencias de California.
Thank you, everybody. It's an absolute pleasure to be here in Imperial County, and not just because of the weather. This 80 degrees is a little different than not too long ago when I was here, and I think we had 121 degrees. So what a pleasure for so many reasons today. There's so many agencies here. I don't want to begin to thank all those that have contributed to make this event possible. I do want to specifically thank Imperial Valley College for a number of reasons, not only for putting this mass vaccination event on, but for participating in the care of patients here in Imperial County. From the EMS Authority, we're so grateful. We've been offered a spectacular space here for more than 6 months, where we've housed an alternate care facility, and we've been treating literally hundreds of patients to help offload the COVID burden from these two little hospitals in this community. I want to say it's spectacular to be here today and participate in this because this county has been one of the primary targets for surge and for state support. You've been hit probably harder than, well, you're certainly in the top 5 hardest hit counties in the country. So with that, this event for me offers a degree of celebration. It's a transition towards normalcy. This is the way we get back to normal. This is the way this community can start getting back to normal. It gives us the ability to look forward with an antidote of sorts, this vaccine. It's going to be some work, but this represents a first step in putting shots in arms. This allows us to start taking those steps one patient at a time, which is going to be required to return this county and California all the way back to normal. So we at the EMS Authority are very proud to be part of that. I'd like to send out a special debt of thanks to all of our EMS providers in California. They have really stepped up to fill, I'll say, nearly every medical gap we've asked them to do, including vaccination. The state has offered extended scopes of practice to all the EMS providers in California, including the ability to participate in hospitals like those here in Imperial County, the ability to participate in alternate care facilities like this here at Imperial Valley College, and then most recently, the ability to give vaccinations as we're going to do here with 10 lanes of traffic, targeting the most vulnerable population here in Imperial County, those over 65. And we hope to hopefully put shots in 1,300 patients to take a big step forward towards watching this thing wane off. And I'm going to say I'm really looking forward to seeing this thing in my rearview mirror, as I'm sure every one of you are. So I think I'm going to look at today as a bit of a celebration. Thanks for inviting us. Appreciate that.
Thank you, Dr. David Duncan. So From here, we're going to move it on to questions from the media. The way we're going to do this is if I could ask you, if you do have a question for our panelists, if you can step up and state your question, and I'll repeat it for everyone else to hear. And then we'll have the panelists respond. Do we have any questions from the media? ¿Hay alguna pregunta que se quiera hacer? Si gusta pasar al frente, por favor, para hacer su pregunta. Sí, la escucho. ¿De qué laboratorio recibieron las vacunas? What laboratory were the vaccines received from?
La vacuna que se estará aplicando hoy es de Pfizer y de Moderna. Vamos a usar los dos. ¿Hay alguna otra pregunta?
Bueno, si nadie más, yo la hago, aproximadamente cuándo se va a volver a aplicar la segunda dosis. ¿Tienen más o menos algún estimado?
Claro que sí. The question was approximately when will the second dose be administered? La segunda dosis, aquí en el condado de Imperial empezamos a aplicar las vacunas de COVID-19 a mediados de diciembre y en sí en el Departamento de Salud ya empezamos a aplicar la segunda dosis a los grupos que cabían en el nivel 1, fase 1A. Así es de que aproximadamente, depende de la vacuna, ya sería 21 días, 28 días para Moderna, 21 días para Pfizer, pero son hasta 42 días que sería aceptable ponerse la segunda dosis de la vacuna.
There's another question from Beyond Borders.
Yes, a question for Kenneth. For the future mass vaccination, is it going to be in conjunction with the hospitals pioneers in our central regional, or is it going to be separate? Is the hospital going to be doing their thing, or is it going to be joint?
So the question is for future vaccinations, is it going to be in coordination with pioneers or in the hospital, All Central Regional Medical Center?
Yes, thank you. So there's a couple of things happening. Vaccine is being received by providers directly, enrolled providers into the CalVax state system. And the Public Health Department is also receiving allocation of the vaccine. As far as mass joint vaccination efforts, this year, prior years, it's been joint efforts. And we have been in communication with both hospitals. There is a possibility that both hospitals and other medical providers will join future efforts. So we are in close coordination and contact with all vaccinating providers.
What measures are in place in case some of the people getting vaccinated today have complications?
So every single person that receives a shot will be sent to an observation area that's right on the south end of the parking lot. And there is personnel that will monitor the area for at least 15 minutes. Each person will be monitored to ensure that there's no reaction to the vaccine.
I know the county has sent letters to the state asking for more vaccines, about 8,000 a week. Have we seen any strides, or can we expect more shipments of vaccines?
So there's been a lot going on. Requests have been made. This next week, we're expecting to receive 1,775 doses in Imperial County. The state currently is letting counties know, usually every Tuesday night, of what the next week's allocation will be. So it's been week by week basis. And so again, what I can tell you for next week, we're expecting 1,775 doses.
On Tuesday, you mentioned at the county board meeting that there would be the shipment of the 1,600 vaccines, and 80% would be for the elderly. Why weren't we told maybe ahead of time, so we could have told people, hey, there's going to be a vaccine clinic, get online at this time so you can sign up
There's a lot that goes behind the receipt of vaccine. For example, I told you that next week we're expecting 1,775 doses. We're expecting. We don't know if they're actually going to make it here. The other situation is we need to ensure that the temperature was not compromised in transit. So there's a lot of logistics that need to happen. We need to have the vaccine in stock. So for example, the vaccine that we received was a Tuesday. We checked, made sure that all was fine, and then next day it was announced, and today we're having a clinic. So it's been a very quick turnaround from time of receipt to time of actual vaccination of individuals.
But how do we ensure there's equity, for everyone? There's some elderly people, they're not on Facebook, so they need to be given maybe just a heads up, and that's what we're here for in the media, to let them know.
There's been a few efforts launched, and we've worked in partnership with several of our community agencies. About 2-3 weeks ago, we started working with the Area Agency on Aging. They've set up some call center lines. There's actually 2 coordinators that are helping individuals to respond to questions about COVID-19, but more specifically about the vaccine. They are also helping them make appointments, not only with the public health department, but maybe with other providers that have the vaccine available. So at the health department, we've also increased the number of individuals who are at the call center that not only take questions, but are also now helping them make appointments when vaccine is available. That actually happened yesterday. And now we also launched a campaign. It's Help Us Help Them. And for several weeks now, we've been saying, you know what, we understand there are access issues. We understand not everybody has a computer or internet access. But, let's do our part. I, as a child, I, as a grandchild of maybe a senior citizen that does know how to navigate the web or does know how to, make appointments, let's help them. Let's help them make that appointment. Let's pick up the phone. Let's call. Let's check in on our neighbor if they're a senior citizen and ask, have you made an appointment? Is there anything I can help you with? And more agencies are coming to the table because they understand the need and we understand the challenges. So those are some of the steps that we've taken, and for sure there's a lot more that we need to do.
Thank you so much. Are there questions from any other reporters that are here today? There was a question over here. Julio, if you can step up so we can hear your question.
Yeah, I was hoping you could tell me a little bit about the personnel here, who's here, what agencies they represent, and whether or not any of them require additional training to be able to help in this.
So the question is if we can do a recap of the agencies that are here today, who's here, what are they doing, and are there any special training that they needed to have in order to be able to participate in today's clinic?
Yes, so participating agencies include the Imperial County Office of Emergency Services, Imperial County Public Health, Imperial Valley College, Imperial County Sheriffs, Imperial County Public Works, AMR, Imperial Irrigation District, Imperial County Department of Social Services, Area Agency on Aging, American Red Cross, CalMat, Imperial County CEO's Office, and IBC Fire Academy and IBC Nursing students. So yes, there's professionals at each of the clinic areas. So we have nurses, we have those qualified vaccinators at the vaccination stations. We have law enforcement helping to direct traffic. There are briefings, there are trainings that take place. So did that answer your question? Thank you.
Any other questions from any of our other media? ¿Hay alguna otra pregunta de nuestros medios de comunicación que le quiera hacer a los panelistas? No other questions from our media? Okay, just some additional information. I do ask that when you leave the premises and you're done with your coverage, if you can please return your vest to the staff that assisted you with the parking this afternoon, this morning, so that we can reuse those vests for other events. So please do that and help us with that. Again, we will give you indications when we go to cover the observation area. As you can probably see, we have not started with vaccinations yet, so that is going to take some time. So they'll probably get ready to start in the next few minutes. So you can hold on and take some pictures and images of that as that happens. And we have staff here. If some of the public information officers want to raise their hand, that are here, like Gil Riveryar and Andrea Bowers and Elizabeth Espinosa. They can accommodate you and walk you over. The observation area is going to be on the north parking lots of the campus. So as you make your way over there, please stay on the sidewalks. Please do not step onto the parking lot, just because there's still moving vehicles and we need to keep those lanes open. Okay? So are there any other questions from our media?
Question, for their second dose, where will they be notified for that?
So the question is, on the second dose for the people who are receiving their vaccine today, how is that process going to happen?
So we are using the PrepMod system. That's the state system. There's information that's collected. So we will automatically, when they're due for a second dose and we schedule the second dose clinic, they will be automatically informed that that is happening. We have also, we're looking at the situation of if individuals received a second dose, the first dose, I'm sorry, elsewhere, we're going to set up second clinics as well, but that's going to be in the near future. It'll be announced. Thank you. Claro que sí. Sí, claro.
Digamos que las personas mayores accesan a la página. ¿Cuál es el requisito que ellos necesitan? O sea, nada más qué datos tienen ellos que meter.
Sí, son pocos los datos que tienen que meter. Es el nombre, la edad, la fecha de nacimiento, si tienen algunas condiciones médicas, si tienen o no tienen aseguranza. No hay costo para recibir la vacuna, pero si tienen aseguranza, lo pueden incluir y solamente, y ya de ahí los lleva a una área donde pueden hacer su cita.
También no la puede contestar en español, por favor. Dice que la siguiente semana se van a recibir más dosis. ¿Cuántas dosis van a ser las que se van a recibir?
1,775 dosis.
Ok, gracias.
De nada.
There's an additional question from Ivy Press.
The 1,700 that are going to be hoped for received next week, any idea how those are going to be distributed?
So the question is, of the additional 1,700 vaccines that are going to be received next week, do we have an indication of who that is going to be offered to?
Yes, so we're working with baseline information, and so we are vaccinating tiers 2 and 3 and 65 and older. So based on the baseline numbers, about 80% of that vaccine will be for 65 years and older. The rest will be for tiers 2 and 3 providers.
Are there any other questions from our media this morning? If we don't have additional questions, then we'll wrap up this portion of today's news conference. As you can see behind us, some of the vehicles started already arriving into the lanes. So if you want to take a few minutes to take pictures and video, if you would like to do that. And then we will walk anybody over who's interested in talking to participants over to the observation area. So we'll give you, let's say, about 15 minutes before we start doing that. Thank you, everybody.